Welcome to the First Fill. My name is Yara Alsher, and I serve as the Executive Fellow in Education at APHA. I'm very excited to be your host today to discuss one of my favorite topics. Today, we're focusing on a crucial aspect of pharmacy practice, transitions of care, where pharmacists play an essential role in ensuring medication safety, preventing errors, and improving patient outcomes. From conducting medication reconciliation at hospital admissions and discharge to collaborating with healthcare teams and educating patients. Pharmacists help prevent medication related errors and reduce hospital readmissions. Transition of care is more than just a process, it's a patient safety priority that impacts overall healthcare quality and system performance. Before we dive in, I'd like to introduce my guests today, Katie and Haley. Katie and Haley, why don't you introduce yourselves?
Thanks, Yara. Hi, everyone. This is Katie Meyer. I serve as the Senior Director of Content Creation at APHA, and I'm excited to talk about this topic today with y'all.
Thanks for having me, Yara and Katie. My name is Haley Mook. I am the Senior Manager of Custom Education here at APHA. Looking forward to this.
Welcome. Excited to have you both here today. A key focus of our conversation today will be the ISMP Best Practice 21, which outlines strategies for preventing medication errors during transitions of care. We will also explore how pharmacists contribute to hospital performance metrics by aligning with the Joint Commission and Centers for Medicare and Medicaid Services, the CMS, quality measures, including medication reconciliation and post discharge interventions. In part two, I'll welcome an expert in the field, Larissa Betajou, and we'll focus on strategies for preventing medication errors during transitions of care with an emphasis on medication reconciliation and effective collaboration across healthcare teams. So let's dive into today's discussion on how pharmacists can optimize transition of care interventions to enhance patient care and safety. Katie, can you level set with our listeners about what transitions of care entail, the importance of involving pharmacists, and the prevalence of medication errors during these transitions?
Of course, Yara. So, from a definition perspective, the term transitions of care refers to the movement of a patient from one healthcare setting to another. This could include not only changes in levels of care, for example, from the hospital to post acute rehab, but also changes in providers or services. Evidence has demonstrated that poor communication among healthcare providers, a lack of standardized processes, and shifts in patient acuity can leave patients vulnerable to medication errors during these care transitions. While being discharged from the hospital is often seen as a positive step, the process can be fraught with medication related changes. Patients may struggle with new prescriptions, unclear instructions, or unexpected costs that make their medications unaffordable. Every year, medication errors contribute to over 7,000 deaths. One study found that 30% of patients experience at least one medication error during transitions of care. The good news is that we as pharmacists are well equipped to play a vital role in ensuring smoother transitions, preventing those medication errors, and improving patient outcomes. Research has shown that pharmacist led interventions during transitions of care can reduce hospital readmissions, minimize medication errors, enhance overall health care outcomes, and improve patient satisfaction. They also help decrease the inappropriate utilization of healthcare services, reducing costs while improving outcomes.
Thank you, Katie. Haley, can you share with our audience some pharmacist led interventions during transitions of care that have been shown to improve patient outcomes and reduce readmission rates?
Absolutely. So, pharmacists can play a crucial role in transition of care. Their interventions, such as medication reconciliation, patient education, identifying and addressing barriers, and ensuring effective handoff communication, significantly improves medication management during these critical transitions. It's also essential to emphasize the importance of interprofessional collaboration and communication among healthcare providers and their patients. When the entire healthcare team works together, patient outcomes improve and avoidable complications decrease. Pharmacist led interventions have been shown to reduce avoidable hospital readmissions, decrease medication errors, and enhance overall patient care. Some key interventions include medication reconciliation, or MedRec, which is reviewing patients' medication lists at admission, during transition, and at discharge to identify discrepancies, prevent medication errors, and ensure continuity of care. When conducting a medication reconciliation, over-the-counter medications and herbals should also be included in that medication evaluation. Additionally, a second source such as a patient's prescription refill history or previous medical records from another healthcare provider should be utilized to ensure accuracy. Patient and caregiver education is another piece of this, so providing guidance on medication regimens, potential side effects, and adherence strategies to improve patients and caregivers in managing medications correctly post discharge. Collaboration of healthcare teams by working closely with physicians, nurses, and case managers to optimize medication therapy, prevent adverse drug events, and tailor treatments to individual patient needs. Follow up calls or visits by conducting post discharge follow ups to address medication related concerns, reinforce adherence, and identify complications early to prevent readmissions. Targeted interventions for high risk populations by providing intensified pharmaceutical care for patients with complex medication regimens or multiple comorbidities, reducing hospital visits and improving long term health care outcomes. And finally, ultimately, pharmacist led interventions not only enhance medication safety, but also play a vital role in reducing hospital readmissions, improving adherence, and supporting better overall health care outcomes.
Thank you, Haley. With that information in mind, Katie, can you give our listeners a high level overview of ISMP's new Best Practice 21 for 2024-2025 and how it aims to prevent medication errors during transitions of care?
Of course, the Institute for Safe Medication Practices, or ISMP, recognizes that medication discrepancies and incomplete or inaccurate information are major contributors to errors during transitions of care. To address this, ISMP has expanded its targeted medication safety best practices to include transitions of care. The new strategies introduced in Best Practice 21 focus on preventing medication errors across the continuum of care, and these include obtaining the most accurate medication list possible upon admission before administering the first dose of medication, except in emergencies or urgent situations, of course. The patient interview should include asking about allergies and associated reactions, collecting information on prescription and over the counter medications, including herbals and dietary supplements, documenting non-enteral medications such as injections, inhalers, and patches, and listing each medication's name, dose, frequency, indication, and time of the last dose. In addition to specifics regarding what should be obtained on the medication list, ISMP provides the following process-related recommendations. Organizations should assign dedicated practitioners to obtain medication histories to ensure accuracy and consistency. Those practitioners should verify that the medication and doses collected and subsequently prescribed are appropriate for the patient's current health status. A provider should also be designated to compare prescribed medications against the patient's medication history and resolve any discrepancies. This process should be documented thoroughly, with reconciliation and any modifications made at key transition points, such as upon admission, with each change in level of care and at discharge. By implementing these best practices, healthcare organizations can significantly reduce the risk of medication errors, ensuring safer and more effective transitions of care for patients.
Thank you, Katie. To wrap up, let's shift gears to quality measures. The Joint Commission and the CMS have established key guidelines that emphasize the importance of effective transitions of care. Haley, can you share some key highlights?
Absolutely. So, the Joint Commission has identified several safety measures that positively impact transitions of care, particularly in medication management. So, these include involving pharmacists and MedRec whenever possible. Pharmacists play a vital role on interdisciplinary teams by conducting medication interventions during transitions of care. This applies across all healthcare settings, and studies estimate that for every $1 invested in a pharmacist's time, healthcare systems save approximately $12, emphasizing that safe, high quality transitions of care are crucial for accurate medication management and positive patient outcomes. Each transition, whether at admission, discharge, or between care settings, presents an opportunity to enhance patient safety and prevent medication errors. Additionally, the CMS Hospital Readmissions Reduction Program, or HRRP, is a Medicare value based purchasing initiative aimed at improving communication and care coordination. Its goal is to better engage patients and caregivers in discharge planning, ultimately reducing preventable hospital readmissions. One of the key measures of HRRP is the excess readmission ratio. or ERR, which assesses hospital performance based on readmission rates for certain high risk conditions. Additionally, CMS penalizes hospitals with a high 30-day readmission rates for certain conditions, and that's why hospitals prioritize pharmacist involvement in transition of care programs. CMS also provides various resources on care transitions and medication management, which are available in their publications. For example, their Transitional Care Management Services, Chronic Care Management Booklet, and the Community Based Care Transition Program, or CCTP, to help healthcare organizations improve patient outcomes and reduce readmissions. By prioritizing effective transitions of care and integrating pharmacist led interventions, healthcare providers can enhance patient safety, optimize medication management, and reduce avoidable hospital readmissions.
Thank you, Haley and Katie, for providing such valuable insights on pharmacist led interventions during transitions of care, highlighting the 2024 2025 ISMP Best Practice 21 and discussing the quality measures by CMS and the Joint Commission. In our next episode, we'll be hosting Larissa Bethachu, a transition of care pharmacist dedicated to improving medication safety and transition of care best practices. We'll focus on strategies for preventing medication errors during transitions, with an emphasis on medication reconciliation and effective collaboration across healthcare teams. All right, to summarize major takeaways from our time here today, pharmacist led interventions during transitions of care can reduce hospital readmissions, minimize medication errors, enhance overall healthcare outcomes, and improve patient satisfaction. Poor communications among healthcare providers, a lack of standardized processes, and shifts in patients' acuity leave patients vulnerable to medication errors, adverse drug events, and unnecessary hospitalization. Addressing these gaps through structured processes is crucial. Best practices such as ISMP's 2024-2025 Best Practice 21 stress the importance of obtaining and verifying an accurate medication history at every transition point, admission, level of care changes, and discharge to ensure continuity of care and prevent discrepancies. All right, folks, that's all we have for today. Look out for part 2 of this month's First Fill podcast that will be released next Thursday. For those interested in transitions of care, we've just launched the BCGP webinar series and APHA's case study recertification series for 2025. This month, we're focusing on addressing social determinants of health and transitions of care, so don't miss it. And last but not least, don't forget to head over to the Learning Library at learn.pharmacist.com to earn your CE for this month's podcast. We'd love to hear your feedback on how you like the new setup. Take care. Goodbye.